everyone, welcome back to the Rewind Report.
Hello.
Tonight we're going to be talking about one of our favorite treatments, biostimulators.
Yep, it's all about regenerative treatments these days, so we're going to get into the nitty-gritty and talk about the 3 most popular biostimulators on the market as of today.
And our favorite thing to do.
And our favorites,
It's very natural.
First, we can explain a little bit about what a biostimulator is. There's a lot of things on the market that you can inject for aesthetic purposes, but a biostimulator is an injectable that stimulates collagen and elastin. It uses your body's own abilities to harness its own collagen and elastin.
And growth factors.
Stem
cells. I have 2, but when you're younger, you have millions, right? Thousands.
Yeah, and so some of them use our own growth factors, some of them are going to be synthetic growth factors, but what they all have in common is that they all stimulate collagen and elastin, and they're all going to be a little bit more natural of an alternative to something like filler.
Yes. So, Megan, why don't you go first and let us know what your favorite thing is to do? Well, one of them.
One of them.
One of many. Sorry.
One of the probably the most popular biostimulator, if I had to argue it, is something called Sculptra. Sculptra is made by the company Galderma, and it's been out for several years. It actually, a fun fact, came out during the AIDS pandemic, and it was an accident that it became very popular in aesthetics. So HIV was, taking over, and there were many victims to it. What they noticed is that the ones that recovered and survived were extremely gaunt after treatments because it is a devastating disease. And so Sculptra was born on accident because they used this enzyme to help restore an HIV or AIDS patient's face that became gaunt and lost volume, and it worked amazing. So Sculptra's tried and true, been around a long time, and now we use it in aesthetics as a natural volume replenisher, and I love it. So Sculptra uses something called PLLA. This is an enzyme that promotes collagen production. So we often, all of us, I think, explain it to our patients like, think of your skin prior to treatment kind of like a dirt field. There's no grass, it's just been plowed, there's nothing on it. We're gonna lay seeds to grow new grass. So we're gonna lay PLLA within your dermis, and over time, a plentiful amount of collagen is gonna grow, and you're gonna have much thicker skin. You're gonna have smoother skin because it's gonna minimally volumize your skin, so kind of smooth out those fine lines and wrinkles, and you're gonna get some volume restoration where you're hollow. It's very easy to do. It's pretty much painless. We numb you. It's one poke. You don't have much bruising. And yeah, it's an amazing treatment. I would say the one con to it is that it's not an instant gratification, as with most regenerative treatments we do. So you kind of have to be in it for the long run and trust the process, because we typically say it takes about 3 months to see Sculptra results. And on top of that 3 months, it depends on your baseline. You may need more than one treatment of Sculptra. But I do it often, and anybody that comes in asking for filler, I often suggest that we start with Sculptra first so that we get a very healthy, good baseline, and you need way less filler, if maybe not any, after your Sculptra treatments.
Yep, and we usually suggest 3 in a year.
We usually suggest 3 depending on your age. Speaking of age, I think that's a good point to make with Sculptra, since she's going to talk about another one, Easy Gel next. Ideally, I would pick Sculptra over Easy Gel for a more mature client, so that you have an optimal amount of collagen increase, versus with your own stem cells. As we age, we lose collagen, regenerative cells, or the ability of the body to produce more collagen drops drastically through the years. Actually, starting in your late 20s, I believe you lose 1% every year. So somebody that's more mature, maybe 60-year-old client, I would prefer to do Sculptra, just so that their outcome is more so guaranteed than if they did Easy Gel.
Yeah, I agree.
Yeah, and piggybacking off of that, with Easy Gel or PF, depending on the patient, we can't quantify or qualify their growth factors.
Right.
Whereas with something like exosomes or Sculptra, it's a little bit more guaranteed.
Yes,
Absolutely.
per bottle.
All right.
So I'll move on to Easy Gel, which I do love, even though I am not 60, but I'm not that far away. So if I were to come in and get my blood drawn for Easy Gel, well, I'll tell you the process. You come in, you get your blood drawn into a blood tube, collection tube. And then one of us will take it into the back, we'll spin it. Then we will pull the golden liquid from the top, which is your PRF and your stem cells, hopefully. And then we heat it, and then we'll cool another tube for just the PRF, and we mix it together, and it becomes this golden gel. Then we kind of place it the same way we place Sculptra. So we always numb here, always. We numb the little spots that we're going to enter with a cannula, because all three of us like cannula over needle. Just preference of choice, not right or wrong. And then we place it in any kind of volume depletion region in your face. Or if you come in and you say, I just want this a little tighter, we can put it in the preauricular area. We can put it down on the corners of your nose, the piriform aperture, to kind of lift a little bit the lip and this lower face area. We can do tear troughs. We all like doing tear troughs with Easy Gel. And it's another treatment, I would say. It looks really good before you leave, but it will kind of reabsorb. So we always suggest 3 Easy Gels. And the younger you are, the more growth factor and stem cells that you will have in your little tubes, but it doesn't stop me from getting it.
Or your lifestyle, right? If you eat healthy, you exercise, you're a generally healthy person, even if you're older, you still are likely to have good growth factors. It's also like people who smoke a lot or drink a lot, like those are people who are not going to have great growth factors.
So you never want to do Easy Gel after you have a bender. Right?
Absolutely not.
Yeah.
No.
I tell
You're
people,
wasting your money.
I tell people on the phone to drink as much water as they can for about 2 days before Easy Gel, because then we get a better yield when we draw your blood.
Yeah, eat healthy,
Yeah.
sleep, and drink water before your Easy Gel.
At least drink water if you can't eat healthy.
And if you're hydrated and you make a lot of Easy Gel, we'll inject all of it for you, which is nice. Because some people will charge per area, and we say the treatment, we'll charge per treatment, and we'll inject it all.
So it just depends on how much you make, or how much we can draw from you, how much PRF you actually make, and you make more if you're hydrated and healthy.
Yes.
Yeah, and one point that you were going to make about Easy Gel versus Sculptra?
Yeah, one thing that I really like about Easy Gel versus Sculptra is you can put it anywhere. So with Sculptra, under the eyes is off limits, and around the mouth and the lips, that's off limits, just because that's really thin skin. You don't want to have any risks of nodules, whereas Easy Gel, you can put it under the eyes and the lips pretty much anywhere.
Yeah.
So that's a big reason why we're doing this podcast, is so we can explain to you guys like the pros and cons and who's a good candidate for which treatment, so you know which regenerative treatment is the best for you.
Yes, and also your eye muscle and your mouth muscle are sphincters. So if you put Sculptra in there, the little beads of the enzyme can ball up in that area.
Yes.
We're back to the sphincters, aren't we?
Yes. What did you call
Sphincters.
them? The sphincters, yeah.
It's a sphincter. Sphincter? I don't know.
What a tomato. But
I say how you do, actually, sphincter.
You don't want
Sphincter.
Sculptra in a sphincter.
sphincter. You
No.
don't, because it'll ball up. So, yes.
All right.
Okay, go hit it, Courtney.
We have
there.
one more very amazing biostimulator that we also love to use. Before Courtney talks about Radiesse, we have to address an elephant in the room, because I just noticed that it's flying around. Will you please talk about your finger? What happened?
Oh my gosh. I was trying to get a fuzz out of the air.
Well, it's going to be in our podcast, and you're like this and
I'm
demonstrating.
like, I have an idea.
Exactly. I
I
just
had
think
an
we have to
acci-
mention it, right?
Okay, for 2
It didn't happen with a patient. if
No,
you're worried.
and I don't inject with my pointer finger, so I'm fine. I've done several things and I'm fine. I had this dream to make part of the Thanksgiving dinner, because am I a good cook?
No.
Okay, you don't have to be mean though. You could say, no, you're learning.
She's
but-
still learning.
Okay, so I was making scallop potatoes and I decided to buy myself a mandolin, which is the devil. So you just slide it. I did not use the black handle that you stab into your vegetable. I just used my finger, and that's what happened.
And how much of it did you lose?
A decent
Just the tip. Just the tip.
Just the tip is gone. Don't worry, she's on antibiotics and we're doing wound care daily, but that's why her finger is
Wrapped
waving
up.
around.
Yeah, I'll never forget this Thanksgiving, so that's good.
On that note, folks, we're going to get to Radiesse.
I need some Sculptra
Maybe.
on my finger.
I think you
some
could soak
easy
it in
gel.
PRF.
Yeah.
Yeah.
Oh yeah, you did say that.
Yeah.
Maybe I could.
Can't hurt, right?
I'll
Yeah.
use your PRF 'cause my PRF's probably like dead.
Oh my god. So the last biostimulator that we want to talk about, this is pretty much the three that we carry here.
Yeah.
Radiesse is the last one, and it works a lot like Sculptra. It's not made of the same particle, I guess.
We call it cousin.
Yes, it's called calcium hydroxyapatite. A lot of us injectors call it CAHA for short. And it differs from Sculptra because it comes in the form of a gel. So Sculptra comes as a powder. We mix it with water, and then we inject that in your face. Radiesse comes as a gel, so you can, what's really nice about it is it's versatile. So you can inject it as a filler, or you can inject it as a biostimulator. The gel is very strong, so it's really good for like the jawline, or a lot of times for men who need like a bit more structure. So what's fun is you can take a whole syringe of it, half of it you can inject as a filler, and the other half you can dilute it down with water and inject that as a biostimulator.
And it looks so good.
It does, yeah. So it's very versatile, which is nice. The patient gets kind of a 2-for-1 when they purchase it. It has the same benefits as Sculptra as far as stimulating collagen, elastin. It'll give you a really nice glow to your skin. It will replenish lost volume. You can do it in pretty much all the same areas of your face. Usually we like to do it in the mid-face, lateral cheek, temples, nasolabial folds, chin shadows, the neck. We've even done some Sculptra and Radiesse booties. You can get some nice augmentation that way, or help with any like stretch marks or cellulite.
And hands.
And hands, yeah,
For
it's really
older
nice in the
hands,
hands. Or even like the arms, we've paired it with Soft Wave to help with like skin tightening in the arms. So overall, it's gonna do skin tightening, it's gonna give you a glow, it's gonna give you some volume replenishment. But you really do need multiple treatments if you want to get a lot of volume replenishment, I would say.
With
Yeah.
the hyperdilate version.
Yeah. If it's by itself, then it's like a very strong filler.
Yeah. I would say that's probably its difference with Sculptra. Big difference is that standalone you get instant volume, where Sculptra is water based, so you get volume, but that volume is absorbed within like a couple hours, and you have to kind of wait to see volume. So
Yeah.
So if you're someone who doesn't really want to wait for the results of a treatment, Radiesse is a nice in between. It will still get better with time, but you get a little bit of immediate results, which is nice.
Yeah. Yeah, it almost looks like you did get a little bit of filler. So you have instant gratification, and then it grows off that.
Yeah, but I would say as far as overall results, it's pretty comparable. We've looked at a lot of head-to-head studies, and as far as like biopsies afterwards on how much collagen was produced, it's very similar.
Yeah.
So why would you choose Radiesse over Sculptra? Because me and Courtney had, I had a client, and I chose to do Sculptra in her neck, and you said that you often prefer Radiesse in the neck.
Yeah, so on a very like microscopic scientific level, Sculptra is actually, the particles are a bit more jagged, and then Radiesse, they're round spheres. So when they create collagen, the Sculptra collagen matrix is a bit more rough and jagged, and so some say you could be a little bit more prone to nodules, which are like little bumps that form from the Sculptra. Whereas Radiesse, they're round and spherical, and so they kind of just slide by each other, so it's a bit of a softer matrix. And so in areas like the neck where the skin is really thin, I always go for a Radiesse because there's a lot less risk of having any nodules or irregularities.
Yeah. And I was just reading yesterday actually that nodules are most likely to be seen in the neck, especially with older folks.
Oh, and something else really important. So the way that Sculptra works, it actually does elicit a bit of an inflammatory reaction. So similar to microneedling or a laser, where you put your skin under a small amount of, I don't want to say trauma, but damage. Stress is a better word. So that stress causes your body to send cells to fix that stress and stimulate collagen. Whereas Radiesse, it doesn't have an inflammatory reaction. It's completely non-inflammatory. So some people who have autoimmune diseases, it's way better to use something like Radiesse than Sculptra.
Yes, and some people like the inflammatory response, like me. Yeah.
I also think too,
Like, I
since
love it.
Radiesse has a little bit of the filler component in it, that it does look pretty kind of filling larger lines
Yeah.
in the neck. The client I did it on was a very young client and already had a Sculptra
Neck.
that can be used and had pretty much a perfect neck. So I felt comfortable using it. Plus we extremely over dilute our, not over dilute, but it's very hyper diluted Sculptra. So I'm very confident no nodules will form, but also could have been a great candidate for Radiesse. And I think in mature clients, Radiesse is the go-to.
I also think if a lot of times we do have patients who say we don't want any sort of filler, then Sculptra is a great option because technically Radiesse does have a bit of a filler component.
Yeah.
Or Easy Gel.
One thing about Radiesse that it's talked about a lot amongst injectors or people, providers in the field, and I don't know if the average client or person seeking aesthetic treatment knows it, but with Radiesse, one of the big scares or cons to it is that it's irreversible, right?
Permanent.
So it's permanent. So if you do use it as the undiluted or how
Gel,
it comes,
it's gel form.
It's gel
Yeah.
form. How
Yeah.
it comes in the syringe, it itself is permanent. So I would say a big tip to viewers that are clients is make sure whoever's injecting your Radiesse knows what they're doing and is licensed and knows
Absolutely.
protocols, right?
Yeah, you can't really dissolve it. You can go in and kind of dilute it down a little bit more, but you can't dissolve it like filler.
And if it gets in a vessel, I mean, that's a huge problem. So it's definitely something to be very cautious with. Very few occasions where I would opt to do a completely to do Radiesse in its total form.
Yeah, we usually
I would rather just
hyper-dilute.
use a filler. I
Yeah,
think.
yeah.
Yeah. I've chosen to use it in its true form on somebody that really, we've tried other modalities to build out a contoured jawline, and just based on they didn't have a lot of adipose tissue, just I think genetically had a weaker gonial angle, and that's when I chose to use it. But again, it's a safer area. You mark out your arteries and you're down to bone and whatnot. But again, I would advise clients to seek a very licensed professional to use Radiesse. I would say the only place I use it in its true form or undiluted is jawline.
Yeah.
Yeah.
Jawline down to
And it's
bone.
good for men too, who need a bit more.
Great for men.
Yeah.
But
Definitely not for new injectors.
not for new.
I would not say.
Don't go to a Radiesse training.
And start injecting Radiesse. No.
No, or have somebody learn on you.
Yeah.
I would say I advise you don't do that. But between Sculptra and Radiesse in their dilute forms, I would call them cousins, and I'd say somebody more gaunt, I would choose Radiesse, or somebody that didn't want to wait and wanted more instant gratification, I'd probably choose Radiesse. Someone with really, really thin skin, more mature, I'd probably always choose Sculptra, just because of the filler component. And
I feel like Radiesse swells a bit more too.
absolutely
Yeah.
it does, yeah.
So
you're
knowing
gonna
your client, if there's someone who has a busy week or is going to be really nervous about a bunch of swelling, then maybe Sculptra is a better option.
Yeah, Radiesse, you do one side of the face, you turn around, get some gauze to clean them up, and it's done.
Yeah.
So you definitely have more downtime, I would say, with Radiesse. And
Yes.
Easy Gel, I would say I would ideally choose a younger client. I think under 50 is a good ballpark just because of their stem cells and growth factors and collagen production they have.
We'll say this, even being in the older crowd, I've gotten Easy Gel, so it doesn't mean it won't work at all. It just means more than one treatment for positively sure. But it will still work. It's not like for naught if you're over 50.
So everything in life, I think, when you're making a decision comes down to a pros and cons list. I talked about Sculptra, my mom,
about
Shannon,
Easy
talked
Gel.
about Easy Gel, and Courtney talked about Radiesse. So really briefly, I'm going to say if I'm Sculptra and I'm offering Sculptra to the ideal person, it would be somebody that came in, they told me I don't want any filler, I want to look myself but younger and rejuvenated, and I don't want a lot of downtime, and maybe you can do Sculptra on anyone from 30 years old and up. It's going to work amazing, and you're going to be willing to wait for results to gradually kick in?
For Easy Gel, I would say, along with what Megan commented, volume, natural. Easy Gel is good for people with autoimmune disease, which I also have. So there's nothing foreign in the makeup of the substance. It's all from your body.
Not synthetic.
It definitely will be beautiful under 40. And if you're over 40, you just need more than one treatment. So we always suggest 2 to 3 treatments. I would say 3, but it's all natural. It's going to give you volume. Your skin will look glowing, and it's a good thing.
So if I'm Radiesse and I'm looking for my ideal candidate, it would be somebody who, kind of similar to these two, wants to look very natural, does not want to look overfilled, but this person maybe is a little bit more gaunt, has a bit more volume loss than the average person. Maybe they've recently had GLP-1s and they're having a lot of the fat loss in their face, and maybe they have a big event coming up where they're not willing to wait 1 month or 3 months. They want a little bit of a result, but they don't want it to be filler. That's when Radiesse would be a good candidate. Or someone, who has autoimmune, or someone, it's not completely natural, right? It's a synthetic product, so that would be the
Easy
autoimmune.
Gel for for someone so natural,
Yeah.
Honestly, we could go on about each of them. If you have questions about this and you want to go forward with a regenerative treatment, come in and talk to your provider, and we can go through the pros and cons of each. We can evaluate your skin, and we can help you pick the best one for you.
And all of them will leave you glowy and very natural looking.
Yeah, they all help your skin.
All 3, yeah.